Okay, my position is that socialized healthcare is the most effective way to go about health insurance in the United States. The reasons that it's effective include it's been proven to be successful in other countries, and the new health and care reform, there are some flaws in the system. And the proven success is that countries that use universal health care have had good results, and part of this is a higher life expectancy. And according to the World Health Organization, the life expectancy of birth for a person in Japan is 83 years. Canada is 81 years, in the United States it's 78. The infant mortality rate per 1,000 births is 3 in Japan, 5 in Canada, and 8 in the United States. And even though they're getting better results than us, we're still spending $7,285 per capita on health expenditures, while Canada pays half of that at $3,900, and Japan only pays $2,600. And although we're paying for more, we're not benefiting from the results. And I guess with decreased spending, universal health care has been proven to be financially better, as stated by Chris Peterson and Rachel Burton of Domestic Social Policy Division. In 2004, the United States spent more than twice as much on health care as the average Organization of Economic Cooperation in developing country, at $6,102 per person, compared with the average, which is $2,500. And along with the spending, as we become more populated, businesses are choosing not to offer health plans in order to pass more of the cost on to employees. And they only have a certain amount of money they can spend on labor. And therefore, countries that use universal health care are spending a lot less on their care system. Another good attribute of it is lower hospital errors. And right now, the United States has the third highest rate of deaths from medical errors, and the highest infant mortality rate among the 8 countries. And also with the national health care, there will also be a universal database, in which will lead to fewer errors and eliminate the hassle of resubmitting medical history or any other information. And this universal database can also decrease wasteful inefficiencies like duplicate paperwork, claim approval, and insurance submission. And it also makes diagnosing and treatment easier for the doctors, because of the newly input universal database. The doctors can look, and it's just easier for them to treat. And there are also flaws with the new healthcare system that's just been passed, and that's the premiums being more expensive. And according to Catherine Nix of the Heritage Foundation, she states that young healthy Americans will be unwilling to pay the premiums, preferring to wait until they are ill, and that they'll be the losers, and the young and healthy Americans will be the losers in this equation. And the Associated Press predicts that health premiums for young adults will increase by 17%, causing fewer of them to purchase insurance. Also, young people are not willing to spend extra money on the premiums, and would rather pay a penalty and wait until they're sick and need insurance. And with the national health care, they'd already be paying for their insurance, so they wouldn't have to worry about that. And also, there's a decreased number of insured with this system. And Nix states that removing young and healthy patients from risk pools will in turn result in further premium increases, as only the sick and elderly patients will be left, creating a death spiral as cause and effect intertwined to result in ever more increasing premiums, which will cause Americans to drop coverage. And also, the young and healthy people who choose to buy the insurance are actually paying for the sick and elderly, which in some cases have gotten insurance at recent news of illness. And my conclusion is that universal health care is more beneficial than the system we have right now.